Sports injuries, R.I.C.E. Aims of this educast are to explain the term R.I.C.E. and to explain how R.I.C.E. is used to help treat injury. The majority of sports injuries are either to joints, such as sprains and tendons, or to muscle injuries, like strains and pulls. These type of injuries can be best treated at first with R.I.C.E. R.I.C.E. stands for the following. R means rest, I means ice, C is compression, and E elevation. R for rest means that when you injure a body part, such as a joint or a muscle, then you should stop doing that activity and you should rest the injured body part to enable it to recover. I for ice means that you should apply an ice pack to the injured area. The purpose of this is to stop any swelling occurring, because the ice will cool down the blood flow to the area, slowing it down, and that will prevent any swelling taking place. Never ever put ice straight onto the skin. Either use a proper medical ice pack, or if you're going to use ice, wrap it in a cloth so that it doesn't come into contact with the skin, otherwise you could get ice burns and cause other injuries. Same if you go and get a bag of peas out of the fridge, wrap it up in a tea towel. Never put ice straight onto the skin. C is for compression. You would apply pressure to the injured area. Again, it's to prevent swelling. Now normally this would be a bandage, but depending on needs be, it could be that you place your hand along the injured area to keep the pressure down before you seek medical assistance. You might often see a first aider, when treating an injured person that maybe has injured their foot, won't take their shoe off. The purpose for this is that the shoe will act as a compressor. It will compress the foot, compress the ankle, preventing swelling. If you take the shoe off, the foot could swell up, causing other injuries. Taking the shoe off itself could actually cause an injury if there's a broken foot. So C is for compression. You apply pressure to the injured area, and normally that's a bandage. E is for elevation. You'd raise the injured body part. Again, this is to prevent swelling. You want to prevent swelling because if the joint swells too much, the pressure in that area could cause complications. So, if you've injured your wrist, you would keep your wrist up high, up above your heart. You often see a picture of people with broken legs lying on their back with their legs straight up in the air. This is so that the leg is higher than the heart. All it does is prevent swelling. Then seek medical assistance. Once you've done R.I.C.E., get a doctor out, seek medical assistance. So in summary, the term R.I.C.E. stands for R, rest, that's rest the injured body part. I, ice, place some ice wrapped up in a cloth or towel on the injured body part. C, for compression, apply pressure, normally a bandage, to the injury. E, elevation, lift the injury or the injured body part higher than the heart. All of this will aid recovery, mostly by preventing swelling.